allowing them to open so long as people wear a mask and they continue to practice social distancing. Organized sports are also allowed to resume under the order. Michigan reports another 13 deaths and 783 cases of COVID-19. This brings the state's total now to 6,500 deaths and over 108,000 cases. All of this includes 1,500 deaths and nearly 14,000 cases in Detroit. With the flu season just around the corner, parents and teachers may have a difficult time determining flu symptoms from those of COVID-19 in children. Doctors are now advising parents on what to watch out for. CW50's April Morton has the story.
Recent reports by the American Academy of Pediatrics says there are over 500,000 child COVID-19 cases nationwide. Over 70,000 new cases were reported at the end of August, a 16% increase in over 2 weeks.
Kids across the country have been going back to school. There have been certain parts of the country that have reported increased numbers of cases of COVID-19 in children.
Dr. Scott Grants, a pediatrician with Children's Hospital of Michigan, says the increase of COVID-19 with children is mainly due to them having more interaction with others. Prior to schools restarting, children were mainly at home. Now that schools are back in session, cases are expected to rise. And with the flu season quickly approaching, parents and teachers may have a difficult time determining the difference.
Unfortunately, the clinical picture that it creates when you have these infections can be very similar, right? So kids with COVID and flu will tend to have fevers, cough, difficulty breathing, and there's quite a lot of overlap between the symptoms of having a flu infection and having a COVID-19 infection.
Dr. Grant says so far the main symptoms that contrast COVID-19 from influenza is loss of smell or taste and shortness of breath. Doctors saying there may be an increase in flu cases with kids because some parents are still skeptical about taking their kids into the pediatrician's office for a flu shot.
So it's safe to go to your doctor's office and it's safe to have that flu vaccine.
Doctors advise testing as the best way to rule out COVID-19 over the flu. April Morton, CW50, News at 10.
Thank you, April. Coming up after the break, the vaccine race heads to Capitol Hill.